A very good afternoon to one and all present here. I, Dr. Shrutika Jha, has completed my MBBS from Medical College, Kolkata, and currently I am working as a house staff in the Department of Urology in this college itself. The topic which has been given to me is clinical features and diagnosis of type 1 diabetes. So here I begin my presentation. Before studying about any topic, the major question which we all doctors usually ask ourselves, that why should we know about any particular information? Why should we know about the clinical features of type 1 diabetes? Why is it so important to us? The picture I've shown here, I think we all know him, is Nick Jonas. He was diagnosed with type 1 diabetes at the age of 13 on the basis of his clinical symptoms, not just that he was taken for some genetic studies and then it was proven. His father saw the symptoms like frequent urination, excessive thirst, loss of weight, and on the basis of that, he was diagnosed as a case of type 1 diabetes. So now we can all understand what importance the clinical features of type 1 diabetes hold in front of us. So here I would like to tell everyone about some risk factors which were seen. Family history obviously plays a very important role. We have seen the role of genetics in the etiopathogenesis. There's one important point that I would like to say everyone, that it has been seen that the number of people suffering from type 1 diabetes tends to be higher as we travel away from the equator. Then the two age peaks are seen in the type 1 diabetes mellitus. First is between 4 and 7 years old, and the second is between 10 and 14 years old. Coming to the symptoms now, we can see a small girl here who is diagnosing, we see with the glucometer, seeing her sugar level herself. Actually, the children, they are taught like that, like they are able to diagnose their sugar level, they become smart to such that level. So like the symptoms include feeling more thirsty than usual, urinating a lot, bedwetting in children who have never wet the bed during the night, feeling very hungry, losing weight without trying, feeling irritable, feeling tired and weak, having blurry vision. So we can see something from these symptoms that they are not very specific to type 1 diabetes. That's why there has been cases where the disease is misdiagnosed, and also we are not able to diagnose it when they first present to our clinic, because there are many other diseases, the common ones, which are associated with these type of symptoms. Now I would like to move on to the criteria for the diagnosis of diabetes. I have referred for American Diabetes Association for the criteria and the stages. Here there are some basic points which we all are aware of, that if the fasting plasma glucose is more than or equal to 126, and the fasting is defined as no calorie intake for at least 8 hours, then we consider during an OGTT, we take it as 200 milligram per DL, and HbA1c, which is a very important parameter to test. If it is more than or equal to 6.5%, then we consider it. Then, on the basis of some criteria, we have been doing the staging of type 1 diabetes. And this table is also taken from American Diabetes Association. On stage 1, it's autoimmunity, normoglycemia, and they are pre-symptomatic. Symptoms include, which I have mentioned in the previous slides. And the diagnostic criteria, like more than equal to 2 autoantibodies should be there, and there should be no IgT or no IFG. In stage 2, there's autoimmunity, but there's dysglycemia, which may include the fasting glucose level can be between 100 to 126 mg per dl, and they are pre-symptomatic. In stage 3, there is new onset hyperglycemia, but they are symptomatic, along with clinical symptoms, and also we diagnose the diabetes by the standard criteria. Now, some recommendations were given by American Diabetes Association. So, as they considered it very important to diagnose type 1 diabetes at a very early stage. Like, obviously, we should be pursuing it in a very expeditious manner. And also, a pediatric endocrinologist should be consulted before making a diagnosis of type 1 diabetes when isolated glycosuria or hyperglycemia is discovered in the setting of acute illness and in the absence of classic symptoms. Because hyperglycemia in children can be seen in many other cases which are more common than type 1 diabetes. Then distinguishing between type 1 and type 2 diabetes, monogenic and other forms, is based on history, patient characteristics and laboratory tests, including an islet autoantibody panel. Now I would like to talk about the diagnosis of type 1 diabetes in adult. Here I have given a photograph of a Pakistani player. I want to tell that he was diagnosed with type 1 diabetes at the age of 30 before going for any test series. So it's also important to know about that how type 1 diabetes, like we see it's happens in children, but they are they get diagnosed in adults also, and how they are missed. Because in adult, whenever they come to the clinic, always we go the symptoms wise or the glucose wise, we always go for treatment according to type 2 diabetes. But this person was diagnosed with type 1 diabetes at the age of 30, and now he's a part of a driving Genes to Defeat. So in adults, as it's written over there, is difficult because type 2 is the predominant type, particularly with the older age of onset, and misclassification in adults is also there because individual patient management and the clinical classified cohorts has also been reported. Here's a graph is showing that type 2 diabetes and type 1, the number of new cases per 1 lakh people, the number of new cases increasing in type 2 diabetes after the age of 30 is also increasing. So it becomes more difficult to diagnose type 1 in patients who are coming to us in the later part of their life. Here's a graph, it's showing a relation on clinician diagnosed type 1 diabetes who were clinically diagnosed, but and in what percentage the islet autoantibody was also found positive. So if the age is less than 18 years, then the number is more, and if it is more than 31, then it automatically decreases. So we can see some person might be suffering from type 1 diabetes, but as the autoantibodies were not found, they were not seen, so we moved ahead with the treatment of type 2 diabetes. And there was one in genetically confirmed type 1 diabetes, the percentage islet autoantibody positive was seen is it was equal in all the age groups. The screening and testing for type 1, like according to American Diabetes Association, they said that the screening in asymptomatic children, like if there's a suspicion because they have a family history, their sibling is suffering from type 1 diabetes. So with the panel of autoantibodies is currently recommended only in the setting that their first degree family members are suffering with type 1 diabetes, and they are telling that we should consider panel of autoantibodies. Now I would like to end my presentation by talking about misdiagnosis, which is a major concern now. This is just a graph which is showing some numbers that there have been found that there's a percentage of cases which has been misdiagnosed. Okay. So thank you everyone. Now I would like the jury to go ahead with the discussion.